the timer, and here is your question. Right, so if you have read and understood, considering the atheist taking station, can you begin?
Okay, thank you. Good evening, ma'am. I'll enter into the station, I'll wash my hands, and then I'll greet the patient. Good evening, ma'am. My name is Dr. Ajayi Abbas. I'm a SHO in this team. I've been asked to interact with you. Can I go ahead?
Yeah, sure.
All right. What's your name and age?
I'm 36-year-old. My name is Mary.
Oh, okay, Mary. Can I call you Mary?
Sure, you can.
All right. Okay, Mary. So what how may I help you today, Mary?
Doctor, recently I was feeling very breathlessness. I'm getting very sweaty. I'm getting very anxious recently.
Oh, so sorry, Mary. For how long has this been happening?
Almost, doctor, for 6 weeks.
Oh, Mary, you look really scared and worried. Don't worry. I'm sure you'll be fine. It's just, I'm sure it's not, hopefully it won't be anything serious. So you should just calm down a little. I'm sure we'll be able to, with our interaction today, we'll be able to assess what's wrong with you. I hope you're okay with that.
Yeah, sure, doctor.
All right. So for how long have you been having this breathlessness?
Doctor, for the last 6 weeks.
Oh, so sorry, Mary. How frequent does it happen?
It was happening every day, doctor.
That's so sorry. How long? How every day? Does it happen sometimes? And then, is there anything that makes you feel breathless?
Yeah, doctor. Whenever I walk for quite a few distance, like 100 meters or in my yard, then I felt very breathlessness, and I have to sit down.
Oh, so sorry. Does it get worse when you lie flat or at home at night when you're sleeping?
No, doctor. I have a
Okay.
calm sleep, but sometimes there is a night awakening also.
Oh, so sorry. So you get scared. Do you feel as if your heart is beating fast whenever you wake up suddenly?
Yeah, doctor. I
Oh,
I am able to feel my heart rate, doctor.
oh, so sorry.
It's difficult. It's difficult for me to get into sleep, doctor, these days.
Oh, so sorry. So sorry. For how long do you have to walk before you get the breathless? You
I
said when
told
you
you,
walk.
doctor.
For how
100
long?
meters, doctor.
Oh, so
It's for
sorry.
last 6 weeks. It's for 6 weeks only.
So sorry. Can you be? Is it possible for you to climb stairs? Do you get breathless when you climb up stairs?
Yeah, doctor. Hardly 2 to 3 flights of stair I am able to do, doctor, these days.
Oh, so sorry. Do you have a cough?
No, doctor, I don't have any cough.
Do you notice whether you breathe as if you have a wheeze, as if there is
No, doctor, I don't feel any wheezing or anything.
Okay. Do you have a fever?
No, doctor, I don't have a fever.
Okay. Have you lost weight recently?
No, doctor.
Okay. So did this anxiousness you had, did you get any news or something? Did you have any idea what actually caused it for you to start getting anxious?
No, doctor, I don't know why this has happened. My surgeon told me I need to go for a surgery to remove a stones in my gallbladder. I don't know, but why it is happening, I don't know.
So,
Don't have any
so sorry.
comorbidities.
Okay, so sorry. So you're not hypertensive or diabetic. You don't have any of those.
No, doctor, I'm very young.
Okay. Oh, okay. So sorry. So sorry, Mary. I guess it's because you're a bit worried about the surgery, isn't it?
I don't know,
Or
doctor.
what are
Every
your
patient is
concerns,
get
Mary,
worried
about?
about surgery.
What are your concerns, Mary? What are your concerns?
I want to get rid of this breathlessness. I'm literally get pissed off with this.
So sorry. So sorry, Mary. We will be able to follow in our interaction with you, and then when we do some examinations, and then some investigations, I'm sure we'll be able to get to the root of the matter and then treat you appropriately. Do you have any expectations from this?
Yeah, doctor, I want to get rid of this.
Okay, you'll fine. You'll be fine. Or we'll together. We'll ensure you get better. All right. Do you have
Hopefully,
any
doctor.
history? Have you traveled abroad recently, or do you live beside any factory?
No, doctor. I
Okay.
haven't traveled
Do you
recently.
smoke? Do you smoke or consume alcohol?
Yeah, occasionally I smoke.
Okay. How many sticks? How many packs per day?
Sometime daily one
Okay.
cigarette a day.
Okay. What about alcohol? Do you take alcohol?
Sometime, doctor.
Okay.
Weekly for recreation.
How's the home front? Are you married? You have kids?
No, doctor. I'm unmarried. I live alone.
Okay. Um. Do you okay. What do you have any allergies?
No, doctor. I'm not allergic to anything
Okay. Are
as
you
of
on
I know.
any drugs?
Sorry, doctor.
Okay. I said, are you on any medications or do you take any
No,
recreation?
doctor.
Can
No,
you
Okay.
present your case now?
Thank you very much. I have interacted with Mary. She's a 36-year-old lady who presented with 6-week history of shortness of breath and worsening, which has been worsening over the past 6 weeks with associated with worsens with ambulation movement, with worsening breathlessness when she walks over 10 meters and then about 2 flights of stairs. Initially, symptoms became prominent after she was informed about a diagnosis, the plan for her to have a cholecystectomy 6 weeks ago.
So what are your differential diagnosis for this patient?
Yes, ma. I think she has preoperative anxiety.
Okay.
Yes, ma'am. It can also be chest infection. It can also be as a result, even though she's not a hypertensive and she doesn't have history of she doesn't have a history of hypertension and then no cough or difficulty breathing. So although it might also be heart failure. Considering the fact that can also be myocardial infarction. Yes,
yeah.
myocardial
Okay.
failure.
So how do you intend to manage this patient?
Yes, ma'am. Considering the fact that she has a history, I would want to refer to her GP to also discuss with the GP for possibility of retrieving her previous notes to assess if there's a previous history of similar symptoms in the patient, and then check for the previous investigations she's done. Then I would investigate her. I would update her investigation, do a chest X-ray and electrocardiography. I also interact with the cardiologist. I'll use a multidisciplinary mode of management, interact with the cardiologist and do an echo and then assess her, then take bloods for full blood counts and then serum electrolytes, urea and creatinine. My aim is to discuss with the patient on her treatment and then reassure her, tell her that she'll be well looked after, that there won't be any problem for us from her surgery, and then so that she would be a bit calm and then to allay her fears. I would also want to do family therapy if she has friends. Considering she lives alone, I would discuss with the patient if she has friends that we can talk to help her discuss and then her get better. We can also institute group therapy for patients who have had previous cholecystectomy, discuss with the patient to help her understand that it's not a significant problem. Yes, ma'am.
Hence, according to your opinion, do you think that surgery should go ahead?
Yes, ma'am. From my interaction, patient has no non-comorbidities, no cardiac or respiratory pathology. So I think she can actually go ahead with the surgery.
Good, good. Okay. Basically, you've covered everything. Just one small, when you were asking, because patient is a planned elective case and is already on list and has cholecystitis or needs to go for laparoscopic cholecystectomy. So you could ask maybe about the pain. So
Okay.
and grade the pain from 1 to 10.
Yes, ma'am.
That you could, that is something you've made. All the rest, I think you have asked. You even asked about the eyes. So everything, I think it was covered because this is what I was told. If anyone else have noticed anything and want to give feedback, so they can.
Thank you, ma'am.
Thank you. Started, and here is your question.